All right, I think we'll get started. We'll start with some introductions. My name is David Hoganson. I'm one of the pediatric cardiac surgeons here at Boston Children's Hospital, and I co-lead the complex single ventricle program with Dr. Rahul Rathod, who you see. Dr. Rathod is one of the associate chairs of cardiology and directs the single ventricle program from the cardiology standpoint, and also is the national and international leader in single ventricle management. So we're going to share with you on a couple different topics, and we'll be joined soon by one of our other colleagues, Dr. Naomi Gaither. She's one of our other esteemed cardiologists, and she leads our cardiac fitness program. And in the context of our webinar today, she really has done a tremendous amount of work in the fitness program for our Fontan patients, and she'll share with you about that. So we're going to start with Dr. Rathod sharing with us some about the Fontan clinic. So Rahul, take it away.
All right. Thanks, David. I hope you can see my slides here.
Yeah.
Excellent. No, we're really excited for this webinar and to talk all things single ventricle and Fontan. Please submit your questions in the chat. And we purposely left enough time left over to kind of have a Q&A and get all your questions answered. We wanted to start off by talking about the Fontan at Boston, or FAB clinic, where really single ventricle care is a team sport. But before we dive too far into this, and given there are a bunch of different types of either patients or parents here, I want to just kind of go over some basics of single ventricle physiology. So the normal heart has two pumping chambers. We have one pump that pumps blood into the lungs, and a separate pump that pumps blood into the rest of the body, or the systemic circulation. And what makes single ventricle heart disease so different is that fundamentally we only have one pump. We only have a single ventricle, and we have to do a series of stage surgeries to make that single ventricle pump to the body, and then figure out another way for the blood to get to the lungs. And we'll talk a lot more about that in detail. And this is actually a complex set of diagnoses. There's not one type of single ventricle. There are all different types of single ventricles. Some patients have a big right ventricle. Some patients have a big dominant left ventricle. Some patients actually have two ventricles, but for whatever reason, they have to function as only one ventricle. And most patients with single ventricle physiology need multiple surgeries. So when we're thinking about this as a baby, we see a baby, make a prenatal diagnosis, or see a baby after they're born. We look at the anatomy, and if there's any obstruction to blood flow going out to the body, we do this big operation. We call it a stage 1 operation. And then some babies with single ventricle physiology have obstruction to blood flow to the lungs. And then those patients need kind of extra blood flow. And so we do what's called a PDA stent, or a surgical tube, to provide extra blood flow to those lungs. And then there are some patients who have no obstruction to both systemic blood flow or blood flow to the lungs. And those patients need what's called a pulmonary artery band to balance the circulation. Most patients from that point will go on to get a bidirectional Glenn, typically around 4 to 5 months of age. This is where the blood vessel that drains the neck and the arms, it's called the SVC, is surgically connected to the pulmonary artery. And now, for the first time, half of the blood flow from the body, coming back from the body, all that blue blood, goes to the lungs, but it does so without a pump. And then around somewhere between 3 and 5 years of life, you get what's called the Fontan procedure. And you'll hear us refer to the Fontan physiology or Fontan patients. What we're talking about is patients who've had this type of surgery. And in this surgery, the blood flow from the legs is now surgically connected to the pulmonary arteries. But we have to acknowledge that when we compare the Fontan circulation to the normal heart, that the Fontan circulation is unnatural. we use the single pump that we have, and we pump blood to the lungs, to the body. And then the blood that comes back from the head and the blood that comes back from the legs goes to the lungs without a pump. And so, given that there's no lung pump and that this is what we call a passive circulation, it really requires low resistance to blood in the resistance in the lungs. We need that blood to get through the lungs as easily as possible. And because of this lack of a pump, the pressure in this Fontan baffle, and we're going to talk about this in my second talk, has high pressure, or kind of everybody with a Fontan has high pressure or higher pressure than normal. And we worry about the multi-organ implications of this physiology. So let's talk about single ventricle outcomes. So when we talk about the modern style Fontan operation, those patients who make it to Fontan actually do quite well in the modern era. And if you're getting what we call the modern type Fontan, you'll hear the words extracardiac Fontan or lateral tunnel Fontan. Data suggests that survival at 20 years is actually close to 90%. And this improvement in survival is evidenced by the fact that there's a growing number of Fontan patients with each passing year. We've made great progress, and some estimates suggest that this is an old study that looked back in 2018, suggesting that the worldwide population is somewhere between 50 and 70,000 patients. And the expectation is that within 10 years, and we're coming up with that milestone now, that population will have doubled. And while we can celebrate improvement in quantity of life, we have to acknowledge that there are issues in terms of major adverse events as these patients get older. Now, many of these adverse events disproportionately occur in patients who had older style Fontans. But what type of complications are we talking about? There's a lot of debate on how to define what's called Fontan-associated liver disease, but we know that all patients who have a Fontan have this congestion in the liver. Fortunately, most patients don't have symptoms, but it is something we follow very closely. Arrhythmias are common. About 20% of patients can have a major clotting event. We worry a lot about stroke. A small percentage of patients will have this lymphatic complication called plastic bronchitis, or PLE, or protein-losing enteropathy. We worry about mental health, and we worry about exercise capacity as these patients age. So if we're trying to ask the really important question, how do we improve care in Fontan patients? We came together as a team and identified some core values that really would help us answer that question. It starts by taking a holistic approach to the patient, thinking about them as a whole, not just their individual organs and parts. It was really important to us that the patient was at the center of our care model, both conceptually and physically. And it was clear to us that we needed a team-based approach reaching across multiple specialties and disciplines. So our answer to that question on how to improve care for Fontan patients was eventually dubbed the Fontan at Boston Clinic. And so let me describe this in a little more detail. The FAB Clinic is a multidisciplinary patient-centered care model. Again, our FAB Clinic offers a holistic approach with specialists from behavioral health, exercise physiology, hepatology, nutrition, and of course, cardiology. And in this clinic, the patient comes to one room and all the specialists take turns seeing the patient, literally putting the patient in the center of the care model. And think of the FAB Clinic as really a type of consult you get every 3 years. We do not separate you from your relationship with your primary cardiologist. We're kind of a consult you get every 3 years. We have separate pediatric and adult clinics. We help standardize all the, especially non-cardiac testing. And my favorite part about this clinic is where the entire FAB team comes together and meets before and after each clinic. These conferences include embedded cardiology subspecialists from electrophysiology and advanced cardiac therapies, and we always invite the primary cardiologist to join us. But it's those multidisciplinary dialogue and shared learnings which are the true power of this clinic. This clinic has really taken off. We see patients from almost both domestically and internationally. We've seen patients from over 23 states. And I wanted just to go through a little bit about the concepts and philosophies of each of the domains. So in a very quick fashion, we'll share some of the learnings and thought processes of each of the teams. So we'll start off by talking about team members from the Cardiac Neurodevelopmental Program. They're often the first person on the team to meet the patient and to really help us understand how child and family factors impact access to care. Almost with every patient interaction, they help us shape how the rest of us interact and talk with those patients and family. They do a lot of screening for neurodevelopmental and behavioral health concerns and will establish follow-up and further evaluation or interventions as needed. And they're really good about educating the family about the neurodevelopmental risks associated with having a single ventricle or Fontan circulation. We're going to talk a lot about exercise physiology. So I won't go into this too much detail, but every patient gets an exercise stress test, allowing us to quantitate the exercise capacity and the kind of the adaptations of the Fontan physiology. We've recognized that lower exercise performance in a Fontan is not okay. And so we're actually treating that as sometimes a red flag marker for us to do something different. And then Naomi Gauthier is going to join us a little later, and we're going to she'll talk a lot about exercise as a prescription through our cardiac fitness program, and particularly a tailored approach, how different types of strength training are really important, especially with a patient with the Fontan circulation. Nutrition is often an overlooked aspect of complex congenital heart care. We have registered dietitians who counsel patients on heart-healthy eating practices. We're finding that too many of our patients are deficient in vitamin D or iron. Some of the iron deficiency is so profound that we're actually setting them up for IV iron infusions. And in some of the patients, there are certain complications of Fontan physiology that can actually be improved through nutrition. And of course, for all patients, we set prospective nutrition goals and plans. Let's talk about the liver. Given that every patient with a Fontan circulation has high pressures that result in this liver congestion, there's a lot of concern, there's a lot of anxiety, but too many patients don't understand enough about FALD and sometimes over worry about it. So we spend a lot of time about and teaching about this. While Fontan-associated liver disease and the development of a certain type of cancer is a serious problem, we're fortunate that we only see this in about 2 or 3% of patients, and usually when they're much older. We standardize the testing of the liver, making sure we're kind of having a comprehensive insight into what the liver is doing, and sometimes what the liver is telling us about the cardiac physiology. And there are a lot of patients who, after being seen in the Fontan clinic, it's the first time they've seen a liver doctor. They're actually getting separate follow-up in hepatology clinic outside of the Fontan clinic. In terms of the cardiology approach, I'm not going to go into too much detail, but this is a really complex cohort of patients with numerous active cardiac issues. And while every patient is followed by a primary cardiologist, we are frequently making recommendations and changing management. Many of our patients need kind of a new set of eyes to help kind of think about things differently. And really, we're bringing a type of single ventricle expertise that is relatively uncommon. And as I mentioned before, we have a separate adult Fontan clinic because the specialists required in adult care are different. The care of the adult patient also requires a really a multi-system approach as the comorbidities increase as these patients age. Special thanks to Fred Wu, who leads the adult portion of the FAB clinic. So I want to come back and end with this slide because the Fontan at Boston Clinic is really about this amazing group of people who all come together to focus on Fontan care. Each subspecialty brings a different lens and a different perspective on each patient. And that crosstalk and multidisciplinary collaboration in the conferences before and after each clinic is where those insights are generated and those aha moments that make a meaningful impact on patient care. And it really takes a village. And for sure, all of our FAB clinic patients benefit directly because of these incredible people. Thank you.
That was terrific. Thank you very much, Rahul, for that. I think Naomi is on line. So, hi, Naomi. She's kind enough to share with us about the exercise program for our Fontan patients that Dr. Rathod mentioned. So, Naomi, I'll let you take it away.
Terrific. Well, thank you. Thank you for having me and for the opportunity to talk a little bit about my central passion, which is exercise. And I'm going to share my screen if I can get to the right spot. All right. Seeing that okay? Just get confirmation.
Yep, looks great.
Okay. So I think exercise can be thought of in various ways, and there's a few aspects of thinking about it either as something that we have to do that seems like a chore, something that we're a little bit afraid of, how do we know if it's good for us, or looking at the opposite way, which is sort of exercise as a prescription, meaning you can think about it almost like a medicine. We dose medicine safely, so we know for each person they have a specific dose based on their needs. And you can think of exercise as the same way. So in the right dose, you're going to get good benefit. Too little, it's not going to do very much. Too much, it's not going to be healthy for anybody. That's true of all of us. But when you have it in a nice, safe, and prescribed way, then it has enormous benefit. And the benefit as a prescription is not just like, this is good for you, you should take your medicine, but it also is really beneficial and enjoyable. And I would say empowering, because when you feel strong and confident, it does many, many things for your life. So empowering people with Fontan circulation is part of the reason why I think exercise should be thought of as a prescription. Not all prescriptions are because something's wrong with you. Sometimes prescriptions are to make you really be empowered and full-hearted in all of the ways. Slides advance here. There we go. So why does exercise matter specifically for someone who has a Fontan circulation? Well, there's a number of reasons. So I'll go through a couple of here. So most people know, even when I ask my little guys, why is exercise good for you? They say, oh, it's good for my heart. Well, absolutely. It improves heart function, and regular exercise can really improve how efficiently your blood is delivered, your oxygen is delivered all throughout your body. But also, exercise is going to give you stronger muscles. It also gives you stronger bones and a bunch of other things we'll go through in a minute. And those strong muscles will actually work as a pump. And if you're born with only one pump rather than two, you have the ability to actually have another pump in your system that is going to help with that circulation. Exercise also directly leads to a better quality of life. And the reports are sort of universally better social functioning, better mental health, and fewer hospitalizations. And that's not just because exercise is like, taking like fish oil and it's yucky and you have to do it, but it's good for you. It actually helps to work on the circulation, the brain energy, the mood, and it changes all of those things that leads to a better quality of life. And if you're fortunate enough to have folks around you who will exercise with you, it can be a really social activity too. It can certainly lead to more social functioning by having people feel more empowered and more confident in what they're doing anyway. And that can have all sorts of repercussions in a very positive way. Exercise is also really important for long-term health. Most people know that physical activity is good for your overall body, and it helps to reduce obesity. And obesity really is a problem of all folks in the United States, and actually not just the United States. And you certainly don't need to add any additional factors when you're already coming to see a cardiologist. So thinking long-term is another reason why exercise really for Fontan circulation should be top of mind. So most people say, but how do we know it's safe? Well, I have good news. It is both safe and effective. So there's multiple studies showing that when you take folks who have a Fontan circulation of all ages, that there's no serious adverse events. So in other words, everybody does really well. Also, it's effective. So it's not just, it's so safe that the dose is too small to actually do anything useful. Meaningful, real exercise can have real benefit. And you can show significant improvements in exercise capacity. Now, that's true if all of us went to a personal trainer and we could get more fit. It is very much true if you have a Fontan circulation. Wherever any of us are starting from, our whole goal is to get to each individual's best self. They're both structured programs. So going to a gym, going to a personal trainer, going to a sport, they're structured programs. But also just everyday activities provide benefits. Like children know this, they look, this picture, they will naturally be inclined to want to move and explore and play. And I don't know where we lose that in adulthood, but I wish we didn't. So any everyday activity counts. That could be things like walking to and from your car. It could be stuff that you might do at work. It could be when kids are going up and down the stairs in school. There's many, many things that count for that movement. And there was a really interesting article looking at what they termed super Fontans. So if you haven't heard of this, it's worth understanding or reading about. So instead of saying, okay, who grows up with their Fontan circulation and doesn't do well, and why, and what can we do to make it better? Lots of good questions among that. But instead, these researchers said, who grows up and does really well? Like, who are those folks? And they named them super Fontans. Who are the super Fontans, and what about them is making them so good? And it turns out when they looked at everything, what kind of heart they were born with, hypoplastic left heart or not, like what kind of heart they were born with to begin with, what kind of surgery they had, how many surgeries they had, how old they were, all sorts of different things. And it turns out the number one reason why super Fontans are healthier when they grow up is when they exercise starting from childhood. And the younger and more consistently they exercised, the healthier they were. So how does this work? Well, multiple ways. First of all, it can directly work on the heart to optimize heart function. So it can help with all aspects of pumping and moving the blood around. And there's actual physical changes that do occur with exercise. It also improves lung function, both in terms of how well the lungs are operating, but also in how well the blood is going through and the chest is moving in and out, because the chest has to rely on the heart, on the muscle strength overlying it. That's what makes it move. Your muscles make it move. The stronger those muscles are, the more that's moving. When the chest is moving and the breath is moving in and out, guess what else is moving in and out? The blood flow. So the more we have strength of our chest, the more we can move our air in and out. Also, the more you can pull the blood in and out. And that ties together with this next one down here, if you can see my little arrow, that it strengthens leg muscles. So the leg muscles themselves are the biggest muscles in the body. All of your muscles will act this way, but the leg muscles happen to be the biggest and will have the most blood flow. So they will create a powerful muscle pump. So that pump, as I said earlier, can act almost like that ventricle that someone wasn't born with to pump that blood back through and go in through the Fontan circulation and into the lungs, where there wasn't a pump from the heart standpoint. So you can have stronger chest muscles, or what we call muscles of inspiration, which means helping you to breathe. And you can pull that blood in, and the air, of course, but you can pull that blood in and the muscles can pump that blood in. So the two together can really help specifically the Fontan circulation. And then, of course, you're healthier and you're stronger and you can breathe better anyway. And then it supports whole body health. And this is the part that even some doctors are not as well aware of. It maintains a healthy liver. That's important for the Fontan circulation. It helps with the kidneys. It actually works directly on the brain in multiple ways, positive ways. So it actually helps to grow brain connections. So folks, it helps actually to make you smart. I tell my kids, it helps make you smarter. It actually does help with learning, academic performance, and it helps to control mood. It helps with some of the actual chemicals and hormones that are going and circulating around the brain. So all of those are things that have positive repercussions with exercise. And exercise really actually affects almost every organ in the body. The blood flows everywhere. So what kind of exercise works best? Well, in truth, anything that you will do. So any kind of activities that you or your child enjoy and will do regularly is going to be good. We think about it in 4 primary pillars. One is aerobic. That's your stamina. That's how well you're moving. And really, those are things that get you a little bit breathy. You don't have to be like tongue hanging out, so breathy that you can't hardly stand it. No, you just have to be enough so that you're kind of feeling it, maybe at about this kind of pace. That is going to do wonders. That could be swimming, biking, walking, dancing, really almost anything that gets you to that point. It could be playing tag. Just something that gets you to that point is going to be helpful. Strength training. Now, strength training is actually something we do, resistance training. Again, meaningful exercise done right is safe and effective. Strength training doesn't have to be going to the gym, but it can be. It doesn't have to be using resistance bands, but it can be. It can be doing things that work with the legs. So jumping, swimming, playground equipment, climbing up and down playground equipment, the exercises themselves, or going to a trampoline park and jumping on a trampoline. All of those things are going to help build those leg muscles. And then, of course, you want the other muscles of your body healthy too. So you want to balance. So monkey bars or any type of upper body work and core work. All of those things are important. So aerobic and strength. And then flexibility and balance is really important too. So to have access to full strength and full aerobic capacity, you have to have enough movement. So mobility really matters, and it matters as you age even more. And for whatever reason, human nature, none of us ever do this. We're all supposed to stretch a little bit every day. 5 minutes is all you need. And for whatever reason, it is one of the hardest things to do, but everybody feels better. Now you can just work that into a routine. Yoga is another way to do it, but there's also games like, I can't think of one off the top of my head, but where reaching or where stretching is actually built into the game, and that counts too. And then the last pillar of exercise is actually the mindset. And that's actually thinking and feeling, how is my body feeling? How am I interpreting that? And do I feel confident and empowered to do this? And when you catch yourself saying, oh, I can't do this, we usually teach people to say, add the word yet. And when you do, suddenly you have hope. I can't do this yet means there's something good coming around the corner, and maybe it is there for you, and that spills over into other aspects. When you feel like you can't walk up a flight of stairs and you slowly build up to it and say, oh, I can't do this yet, and slowly, suddenly you go 2 stairs, 3 stairs, 4 stairs, and then you feel like, wow, I can actually did that. It changes you to realize that that mindset that you had of I can't is not a fixed way of thinking, that you actually can. And exercise, you can prove it to yourself. Plus, you're doing direct actions on the brain that will help with that mindset. And the two together is really synergistic. So some folks have enough going on or are unsure enough of how to do this that they need supervision. So we offer at Boston Children's a cardiac fitness program that is that supervised program. Not everybody needs this, but for those who do, that's what we're there for. And we operate as a personalized training program. It's built off the adult cardiac rehab model. So it's a medically approved program and runs through insurance. And it's one-on-one training with our highly trained and skilled exercise physiologists who understand congenital heart disease and all ages, all ages. And those 4 key pillars are what we address: aerobic, strength, flexibility, and mindset. Our structure is twice a week for 3 months. The idea is to give people the tools, not to stay with us forever, but to give people the tools to understand how to do this safely. What's their prescription? And how do they, once we know it's a good zone, then they can continue that forever. We do check in to make sure that people are staying on task or have questions. And we always start in person. And then we have worked in some virtual training so that we can have both as a complement for people's convenience. I already said it was safe and supervised, and it's carefully individualized. It's crafted per each person. Our expert team has been doing this for, like, at Boston Children's, we have had an expert team doing the exercise testing for decades. our program, this particular program has been going since 2017 in its current format. We actually are just publishing a textbook right now on how to do this, and we're really helping folks all around the nation try to replicate where we come, because we've learned an awful lot and have grown tremendously. We also have collaboration from nutritionists and clinical psychologists for folks who really need to have some of that brain training that's beyond what we can do. And then we provide that lasting education, as I say, teach a person to fish, and they will eat for a lifetime. So we want people to really be educated in how to assess how their bodies are doing, how to know it's safe, and then how to execute in their lives in a way that's going to be sustainable and feel like a gift and not a chore. So that power of that positive mindset, how do we really feel like that is a gift? That's that tapping into that spirit and determination. And when you combine that with physical activity, it's really magical. And our program motto, as you can see on the back of our shirt, is find your possible. And we really truly believe in that. Everybody has a possible. And we meet people where they are and let them show us where that, there's blue sky up there, however high they can go. So having that positive mindset boosts exercise success, it fuels motivation, and it actually improves health outcomes. And we've published some of this already. We know that it reduces stress, and it really improves coping with, certainly with medical challenges, as well as with other aspects of stress, and really can enhance overall quality of life. The power is tremendous. So some practical tips for maintaining that positivity. They can be really simple things that can be worked in. So don't let simple seem not worth it. It's deceptively simple. So one of them is celebrating small victories. I went up one step. Yesterday, I didn't go up any. That's a victory. Acknowledge the effort and acknowledge that that little achievement can build confidence, and over time, 1 step leads to 2, leads to 3, leads to 4. Focusing on strengths, not the I can't, but what can you do? Everybody can do something. If we look toward that, you start realizing what more you can do. Visualizing success. This is a powerful tool that, Olympic athletes use, professional athletes use, really imagining success as opposed to picturing where it won't go well. That's a practice. It doesn't come naturally. People have to be taught, just like I don't know how to do a bicep curl. I'll teach you. How do I think along these lines? Those can be taught, and they can be harnessed, and they can be used anywhere. And then support is the other way, just really surrounding by people who use that positive language, who recognize, oh, I hear you saying like, oh, I'm terrible at this, I can't, and we'll self-correct. How would you speak to yourself? How would you speak to a friend? And having people around you who can say, oh, I hear you saying that. Can we add the word yet? Show me what you have done. Let's rethink this. That can be very powerful too. So how do you get started? Just like any step, it's just taking one step. So first, speaking with your cardiologist, discuss whether you're ready for some exercise. Do you need any expert guidance? Do you need any specific exercise prescription? How about any sort of personalized assessment? Do you need any testing? We do very fancy cardiac exercise testing. There's also less fancy tests that can be done. And are there already activities that you're doing that you didn't recognize, like, oh, well, I dance, but I don't do any exercise? Well, hold on, you do. How do we connect with things that you're already doing? And then sometimes it can take like, do it at a little bit higher intensity, so you get your breathy a little bit more. Start small and dream big. I'm a big believer in this. Visualize it. It's there for you. Begin with enjoyable activities and gradually build endurance and strength. That doesn't mean everybody is going to become an Olympian. And it doesn't mean that we don't have to think about safe levels. Of course we do. But that's true of everything that we do in this world. You don't drive 97 miles an hour on the highway. You drive in safe zones. It doesn't mean you can't drive. And then celebrate progress. Recognize improvements in energy, strength, and quality of life along the way. Because remember, exercise isn't just allowed for someone with a Fontan circulation. It's essential medicine for a fuller and healthier life. I will stop there, stop my share, and I will look to these guys for.
Great. Thank you so much, Naomi. That was terrific. Wonderful. We're gonna transition. I'm gonna talk about how we plan and carry out Fontans using 3D modeling and flow simulation. So let me share my slides here. Perfect. Can you guys see that? Great. All right. So I'm David Hoganson again. I'm one of the pediatric cardiac surgeons here at Boston Children's, and I'm going to share with you our efforts in utilizing 3D modeling and flow simulation, what we call computational fluid dynamics, for both preoperative planning and late follow-up for Fontan patients. This is a program that we've spearheaded here at Boston Children's and now use routinely in our complex Fontan patients. Computational fluid dynamics evaluation is really an engineering effort to study the flow through something. It's computational fluid dynamics is used extensively in aerospace engineering and in automotive engineering to study the flow around airplanes and through different parts of cars and airplanes. And we have applied this technology, as a few other groups have worldwide, to understanding the flow in a Fontan patient, and particularly the flow in different Fontan options for Fontan patients as we think about them undergoing their Fontan completion, or in some cases, even a revision of their Fontan. And so what this computational fluid dynamics can do is simulate and predict the flow through the Fontan, including how well the flow is going to distribute to both lungs, and in particular, the flow from the liver, how that's going to distribute to both lungs. And that's a very important aspect of the Fontan circulation. We need at least a reasonable balance of blood flow from the liver to both lungs to avoid the formation of abnormal blood vessel connections in the lung, called arteriovenous malformations, or AVMs. And this flow simulation can also estimate the energy loss across the Fontan pathway, and that is proven to be quite useful for older Fontan patients where perhaps their Fontan pathway is a little bit narrowed, and we can understand if making that bigger would benefit them. And I'll show you some data on that. So this is really the approach that we take in using this flow simulation or computational fluid dynamics. I'm going to share with you some data that we've generated on validating this approach in real patients that we've used it on. So really, this effort starts with creation of a three-dimensional model of the patient's anatomy from a CT scan, or more typically an MRI. And then from that, we can model different surgical options for a Fontan completion, or at times a Fontan revision. And then we take the patient's own data from their MRI and their catheterization procedure. And then from that, we really essentially construct a mathematical model of the patient's own physiology, including the resistance of blood flow through the lungs and the pressure inside the Glenn or the Fontan pathway. And then we can use all that in this special computational fluid dynamics software to predict what the flow would be like if a patient underwent one of these different Fontan surgical options. So it really allows us to essentially test what's the best approach for patients before we go to the operating room. And this has really been a game-changing step forward for us. And then we can analyze those results and select the best option, and then go forward with surgery. And then an important step for us has been getting an MRI after surgery on as many of these patients as we can, and then validating, did what we say was going to happen as far as the flow distribution, did that really work out that way? And I think that's an important aspect for this to become a real standardized approach. It certainly is at our center, but for other centers to adopt this as we have. And so not only do we use the 3D models to plan the procedures, but we also use them for intraoperative guidance. And many of you will recognize this Nintendo Switch controller that we have reprogrammed to use as a mouse, and we use that on the sterile field in a sterile bag to manipulate the model. And as surgeons, we can both view the heart and the different components of many configurations, but also we use it to make many measurements on exactly how to conduct the Fontan completion or revision. This is some information from our work where we looked at MRIs on patients after they had a Fontan procedure and said, how well did our flow simulation predict the overall distribution of blood flow to both lungs? Yes, ideally it's always 50-50 or a little more to the right. And what our data showed, and in this group of patients that the computational fluid dynamics predicted the right pulmonary artery got 49 plus or minus 8%. And the post-op MRI for this group of patients, there were 10 of them, were 47 plus or minus 8%. So the variation between individual patients averaged only 7% difference between what the flow simulation said it was going to be and what it was after the surgery. And this includes not only the math of the flow simulation, but also planning for the surgeon exactly where that Fontan connection is going to be made, and if any work is going to be done to enlarge a pulmonary artery at the same time. It incorporates the entire process, and this is a really encouraging and excellent result of being able to say with less than 10% variation that this is going to be the way it's going to be after surgery. So this is very encouraging data to us, and we certainly have the largest group by far in recent years who've had this type of analysis before surgery. And the other element, as we talked about a bit ago, is that how is the blood flow from the lung going to distribute to both, or the blood flow from the liver going to distribute to both lungs. That's a very important aspect to get a reasonable amount of blood flow to both lungs. It's a little more challenging because the MRI doesn't directly measure that, and so we have to redo the flow simulation to estimate that. But essentially, from what the simulation after surgery shows, it's also quite close, of 16% variation by patient-to-patient comparison, and the overall numbers are quite encouraging. So in the world of flow simulation for aerospace, anything less than 20% is excellent, and so this is also very encouraging. So we've been thrilled with these results, and it really validates this effort for us moving forward and continuing to apply it to our complex Fontan patients. And I think one of the things that we're understanding that's quite important is how important it is to think about using this flow simulation effort for patients with any systemic venous abnormalities. And certainly, there's a wide range of, single ventricle cardiac defects, and some of those patients have a normal right-sided superior vena cava and right-sided inferior vena cava, and some have different anatomical features of their systemic veins. And what we've seen is that really is a high-risk group for having the blood flow not well distributed after the Fontan procedure. So in the group of 7 different patients that we've done this on, who had some systemic venous abnormality, had we done just sort of the standard Fontan, almost 3/4 of them would have had a really remarkable imbalance of blood flow from the liver to both lungs of less than 15% going to one lung. And that really puts them at high risk of a late complication of developing these arterial venous malformations. But with the flow simulation and looking at different surgical options, we're able to spread that distribution out and get it on average of 36% to the one lung, and then the balance of 64% to the other lung, with a range of 23 to 49%. So this really is a way that almost no matter what your systemic venous abnormalities or arrangement is, we can always find a way to get it to a reasonable distribution. And we target anything above 20%, and we've not seen AVMs form in patients who have that good of a distribution. This is just a couple of examples of how this has been used in real patients that we've treated here at Boston Children's. So this is a patient who was a bidirectional gland and needed a complex Fontan reconstruction. And we looked at what would happen if we did the standard Fontan. And that is shown here in the upper right. We do these flow simulations under 4 different physiologic conditions, looking at it under anesthesia when they get their testing, under normal resting physiology after they eat postprandial, and when they exercise. So really look at how well is this flow going to be distributed over real life. And so for this patient, had we done this just the normal Fontan, they would have had 90% of the blood flow from the liver going to the right lung and 10% to the left lung. And that really would not have been a great outcome. And so we looked at several different options in this patient and eventually settled on this plan of a different Fontan connection that allowed the blood flow from the liver to well distribute. And we got 56% to the right lung and 44% to the left lung. This child underwent that operation and has had a really wonderful clinical outcome. Another example is a patient who had a Fontan many years ago and actually did develop those arterial venous malformations in one lung, and then came back needing to change the organization of their Fontan to better distribute the blood flow from the liver to heal those arterial venous malformations. And so you can see where they started was all the blood flow here shown in blue from the liver going to the right lung. And we're able to devise a plan that we actually change things. So now 65% shown here in the lower right, 65% of the blood flow from the liver went to the left lung to heal those AVMs and 35% to the right lung. So again, really a wonderful way to know beforehand that you're doing the right procedure and getting these patients in a better place. And just going to share with you one additional topic is, sometimes when we need to revise these Fontans, the question at hand has been flow distribution, but also it can be energy loss. And so one thing we've demonstrated a few years ago, Dr. Thought and I and several of our engineering team did this study, and we just showed how when you get your Fontan, there's actually much more blood flow that comes from your upper body than your lower body. And then as you get older, at about age 8, that blood flow return is balanced, equal from the upper body and the lower body. But then by the time you're a teenager at 15, you actually have twice as much blood flow that comes from your lower body. So you're asking that Fontan conduit or lateral tunnel connection, whatever Fontan approach that you have, to handle a lot more flow as you get older. And that can result in more energy loss across that connection and more pressure load on the abdominal organs. And so we looked at that with the flow simulation and said, okay, what is the energy loss across this Fontan connection and how does it change over time? And we've seen pretty striking increases in some patients. And so there's a distribution. Not all patients go up as much as others. On the series that we've done, the patients with the extracardiac Fontan, on average, their energy loss goes up a bit more than the lateral tunnel Fontans, but everybody's energy loss goes up in part because the blood flow from the lower body comes up significantly as they get older. And so we've used the flow simulation to understand, okay, if we need to upsize these Fontan connections, how big should we make it to make things as good as they can be? And we've really seen another nice application of this flow simulation is that in most patients, there's a sweet spot of making the Fontan bigger. And if you make it bigger than that, actually, it gets less efficient. And so we've used these flow simulation also to understand how big to make the Fontan during revision. Just a couple of other examples showing that some patients we have 20% reduction in energy loss, some patients we have 70%, but there's always a sweet spot, and it's impossible to guess that as a clinician, as a surgeon or a cardiologist. And so having the flow simulation allows us to do that. So just in summary, we've used this flow simulation or computational fluid dynamics for both patients getting their primary Fontan and Fontan revision, and a really excellent correlation between the flow simulation and the MRI testing after surgery. And this can help both understand what to do for the Fontan completion and help understand, how and when to do revisions to minimize late complications. And this is really becoming a standard approach at our center, and we're helping other centers to try to be able to offer this also. So I will stop there, and I think Dr. Thought has one more topic to cover, an important update on pulmonary vasodilation medication.
Actually, David, given the time, I think it'd be a good use of the last 10 minutes to just kind of answer some questions we got and maybe have a quick, short conversation between the three of us, and
Perfect.
most importantly, to answer questions. I am, so Naomi, I'm going to read one of the questions to you. And I think it's a really important one. And so the question was, is it too late to start exercise if your Fontan is failing? Now, that's not a word I'm a big fan of, but I'd love your thoughts.
Sure, that is a great question, and I agree with you. It's unfortunate that that's a word that we've handed to people. So that's come from the medical side. So we should own that and maybe change that. And the answer is, without a doubt, no, it is not too late, period. It is not too late. I would recommend for people who are at a point in their Fontan where they're struggling with their circulation, to get expert guidance on how to do it safely and how to do it effectively. But we have, and plenty of others have, taken folks who are really struggling with circulation, lots of medicines, even to the point of needing like things like VADs, if you know what they are, for people who have other kinds of heart conditions. So people not with Fontans, but with other kinds of heart conditions that are really struggling with their circulation, even they can be helped with exercise. So is it too late? Absolutely not. Can there be benefit? For sure. And we think about all four pillars. So some things may change more than others, but everybody can do something with safe guidance. This would require professional guidance, and everybody can see improvements.
Great. And I think, there's a related question to that, is that do some of these children go on to compete in sports, in school age? And maybe you can give some examples of Fontan patients who've done that you've taken care of.
Absolutely. So if the question is it possible? Can folks who have a Fontan type circulation do sports even competitively as opposed to recreationally? There's a little bit of a difference in the amount of just how much the body and the heart have to circulate between the two, competitive and non-competitive. And the answer is yes, absolutely. And there are plenty of examples of people who have gone on to do competitive level sports, even at the high school and collegiate level. The things that you would need to look for, again, this would require professional guidance. This isn't something that people can just kind of do. So you would want to have professional guidance, but we think about things, or in our program, I like to bucket things so that I can kind of keep things clear. So we have come up with 5 buckets, and the acronym for the 5 buckets is FORCE, F-O-R-C-E. Different from your Fontan registry, I know. Anything Fontan is FORCE. So may the force be with you. So F is a function. So we would think about how well is a function working. If the function's working really, really well, which hopefully it is. But even folks who have more limitations, like they're struggling with their circulation or the failing Fontan, we may guide them away from competitive sports, but they can still do something. But we look at their function. That's it. We look at their oxygenation, because that you have to get the oxygen to be able to circulate. So if you have a low oxygen level, that may impact the kinds of sports we might guide people toward or away. But if there's no limitations, that's a good plus. We think about the rhythm, that's the R. So looking at different rhythm considerations is always a question. And then we look at more complicated sort of bucket of things, that's the C, as well as looking at things like anticoagulation, because you think about that if you're going to get hit with a soccer ball in the head, and if you're taking Coumadin, then we may have a conversation about those kinds of things. So there's certain sports that would apply to versus others. But again, either even anticoagulant, just aspirin, or more heavy duty anticoagulation would factor into the competitive sport type, but not necessarily be a no. FORC. And then the E is looking at that elevated load. How much is that body pumping against? How much is it having to deal with? A little bit, David, like the kinds of flow dynamics that you do. How well is the heart handling the circulation at rest? And then you simulated it with exercise, it changes. So we think about those kinds of aspects. And if all of those things are in a good bucket, we have a super Fontan on their hands, and there's no reason that they can't. We have had several who have played competitive hockey. And that has surprised people who played competitive soccer, and certainly at the younger ages, lots of different levels of competitive sports. And there's one patient who has been outspoken at Boston Children's, who's run the Boston Marathon, not once, but twice.
I'm not sure I could run the Boston Marathon.
I know I can't.
Or twice.
Well, wait a minute. I can't run it yet.
Dr. Rathod, you mentioned that the Fontan Clinic, you typically patients are on a 3-year cycle, right? Maybe two important questions there. Is number one, when do you start? When's your first, Fontan Clinic appointment age-wise or time after your Fontan? And then if you're not in the Boston Children's System, how do you get plugged into the Boston Fontan Clinic?
Great question, David. So our care paradigm is meant to be lifelong, but the truth is that we have a lot of testing, and we find that the really young kids struggle. It's a day and a half clinic experience, and so a little bit being kind to the parents. We start the kids around age 6, and we go up to 99. So really, it's a lifelong care paradigm, and again, we have both a peds and adult program. And in terms of getting seen in the clinic, I probably should have shown this slide earlier, but all you have to do is email us at fabclinic@childrens.harvard.edu. You can search Fontan at Boston. You'll find our website. You can also, there's contact information there as well.
That's great. And I know we're planning another event for families coming up later this fall. You want to talk about that and sort of how to continue to get the message out about the importance of lifelong Fontan care?
Yeah, I hope what you're hearing from David, Naomi, and actually we're just the tip of the iceberg in terms of an entire team excited and passionate about the care of single ventricle patients. This is the first of a series of hopefully events where we can meet and talk together. Our next event is meant to be in person. And so we're calling it the Single Ventricle Patient Day. We're going to be hosting this event at the New England Aquarium, obviously being hosted through Boston Children's with sponsorship from a lot of great organizations. The date is September 20th. That's a Saturday, from 10 a.m. to 2:30. It's a free event. We'll have free parking. We will be able to talk in person, have a lot of interactions. There'll be a lot of exciting speakers talking about kind of where are the new therapies, where's the science, some basics. We're hoping we're going to get a bunch of teenagers, and we can even do a teaching session about their own anatomy. Maybe even young adults too would benefit. But it's meant to be interactive, collaborative, and a lot of fun. And then if you want, this event includes a free ticket to the aquarium itself. So bring your families. If you're bringing younger kids, we actually will have volunteers who can help take care of, maybe not babies, but if they're like, 8 or older, we can definitely take them around, and we'll take care of them and make sure they have lots of fun on that day. So we're hoping to see as many of you as possible on September 20th. All you have to do is go to single-ventricle.org and register for the conference. Again, this is a free event, including parking.
Great. That's going to be great. It's going to be great. Good. Well, I think this is we're at the 6:30 mark, so I think we did well on time, and I really appreciate everybody who logged on to the webinar. And I know the team here at Boston Children's has recorded this, and we'll make it available through all of our social media outlets, so others can watch it who couldn't make the live event today. But thank you so much for joining us and participating, and certainly reach out to any of us if you have any additional questions. Have a great evening.
Thanks, everyone.